What's up YouTube? My name is Jimmy and welcome to my channel Envisage. In today's lesson, we will discuss the pathogenesis of clots, followed by clinical manifestation, and finally, the treatment of all the mechanism of action for anticoagulation medication, which also include the acronym for the direct thrombin inhibitors. We will first begin talking about the root cause of every clot, which can be traced back to this chart known as the Vichgrove triad. So the Vichgrove triad consists of three main elements that increases the chance of clot formation. These are the stasis of blood flow, endothelial injury, as well as hypercoagulability. Disease states such as diabetes may cause damage to the blood vessel, thus may lead to a reduced blood flow. As a result of the reduced blood flow, platelets now have more time to interact with each other, and therefore increases the chance of clot formation. Vasculitis, which is the inflammation of the blood vessel, may lead to endothelial injury, which can then trigger clot formation. And finally, COVID-19 is a prime example of hypercoagulability through the activation of neutrophil extracellular traps, which essentially is like the release of the inner contents of the white blood cell, like casting a fish net, which then ultimately triggers inflammation and the recruitment of platelets. Hypercoagulability is the body's intrinsic factor that increases the chance of clot formation. So the clot formation can actually be broken down into two different processes: the adhesion of platelets as well as the glue that binds the platelets together. Let's first envision the clot formation with a real-world example. So imagine scrunching up a couple pieces of tissue paper and then trying to mash those pieces of tissue paper together. The tissue paper in this example can be represented as platelets. These pieces of tissue paper may adhere to each other loosely via the jagged edges, but to truly amalgamate these pieces of these loose tissue paper together, we would need to use glue. The glue, therefore, would represent the coagulation cascades that would eventually form the fiber mesh that binds the platelets together. So the coagulation cascade is actually broken down into two different pathways: the extrinsic and the intrinsic pathways. They're actually shared by a common pathway that leads to the final formation of the fiber mesh. And again, the fiber mesh is what constitutes these platelets to form the actual clot. So the goal of the coagulation cascade is to clot quickly when needed, as well as to not clot under normal circumstances. The coagulation cascade consists of multiple tissue factors that eventually transforms into the fiber mesh. These factors in the coagulation cascade are known as zymogens. Zymogen is like domino-like effect, where the activation of one factor will trigger the activation of another. So due to the complexity of labeling of the coagulation cascade, I will just simplify the schematics of the diagram. As it can be seen, the extrinsic pathway only has two tissue factors. So why is it only the two tissue factor? So the reason why the extrinsic factor has two tissue factors is because if an injury were to occur, the coagulation cascade needs to start immediately to ensure the loss of any potential bleeding. So loss of blood would potentially lead to a decrease in cardiac output and thereby preventing oxygen circulation. The extrinsic pathway also serves as a spark that will trigger the intrinsic pathway to activate. So one of the main reasons why there's so many tissue factors in the intrinsic pathway is to prevent the potential excessive internal blood clotting. So the following is just a chart just to illustrate the concept of the coagulation cascade and may not incorporate of all the tissue factors and anticoagulation factors. So also within the different steps of the coagulation cascade lies the different components of the anticoagulation process, most notably antithrombin 3, protein C and S, thrombomodulin, as well as heparin. So the common pathway starts with the activated factor X, which will then trigger the most important factor 2, otherwise known as prothrombin, to be converted to the active form, otherwise known as thrombin. So thrombin is also the activated form of factor 2. So notice the similarity in terms of the structure from prothrombin to thrombin, as it can be readily activated via the removal of a specific part of the protein. This downstream cascade will eventually lead to fiber mesh or the glue that will solidify the tissue paper or the platelets. So in spite of the complex numbering system, the coagulation cascade, let's envision another real-world example. Imagine being in the convoluted train station in the Osaka metro. For example, there are two friends who are riding the Osaka subway, waiting to eventually meet each other at station N22. The first friend is departing from N11 station, and the other friend is departing from station C13. They will eventually cross paths at C19, where they will share a common pathway to station N22. So this analogy parallels that of the common pathway of the coagulation cascade, where the common pathway will eventually lead to the formation of the fiber mesh, and just like how the two train paths will eventually cross with each other. Next, we will explore some of the clinical manifestations due to the increased risk factor of clot formation. I've separated these risk components into 4 different sections: substance intake, comorbid disease states, inherited blood clotting, as well as anything physically aspect related. So substance intake such as smoking and hormone can increase the hypercoagulable state, which in turn causes an increase in clot formation. So disease states, as previously discussed, such as diabetes, high lipids, will increase the hypercoagulability state, while arrhythmia may affect the stasis of blood flow, which also in turn causes an increase of blood clots. Inherited blood clotting disorder, such as factor V Leiden, may inherently increase the hypercoagulability state. Finally, lack of movement, such as immobility and then confinement to a wheelchair, will lead to a decreased stasis of blood flow. And trauma will result in endothelial injury, which will increase the risk of clot formation. So below are just some of the common clinical manifestations as a result of clot, but does not include all the list. So firstly, deep vein thrombosis, which is usually formed in the deeper vein of the body, such as the leg, can occur either through provoked, such as trauma, or unprovoked, meaning that it may happen spontaneously. Pulmonary embolism, which occurs as a result of the breakdown of the DVT clot, where it may travel through the bloodstream to the lungs, eventually blocking the blood flow of part of the lungs. Stroke occurs when the clot travels to the brain and blocks the blood vessel. Now this can happen 2 different ways. The first way is the blockage that causes the lack of oxygen, which is known as ischemic stroke. Or the second scenario is when the clot causes the blood vessel to burst, which is known as hemorrhagic stroke. And this can be differentiated through CT. Heart attack is the blockage of the clot in the coronary artery, which is causing myocardial damage. So in light of all these clotting process, there is a reason why the body may choose to clot, and that is to protect ourselves. Very much like fever or how our body raises the body temperature to kill potential pathogen, so is the process of clotting. So like in the case of cancer. So cancer patients invariably have a higher chance of developing clots. So in the case of solid tumor cancers, such as breast and lung cancer, this clot formation acts as a defense mechanism to shield the cancer from exploiting the body from further blood nutrients. By clotting the blood vessel around the tumor, the cancer will be depleted of the nutrients to grow. Next, we will go over the mechanism of action for all the anticoagulation drugs. Warfarin is one of the oldest anticoagulation drugs, and it blocks factor 2, 7, 9, and 10. So how do we remember these factors? Well, 2 plus 7 equals 9. We have to just remember one more, so 9 plus 1 is 10. But something to know is that warfarin also blocks the naturally existing anticoagulation factors, which are proteins C and S. And therefore, we would require additional anticoagulation until it reaches a therapeutic level, which is measured in terms of INR. Unfractionated heparin, as well as low molecular heparin, can be classified in a group because they're exogenous anticoagulation that inhibits both activated factor 10 as well as activated factor 2, which is known as thrombin, which essentially inhibits the common pathway. Factor 10A, or activated factor 10 inhibitors, are inhibitors that inhibit activated factor 10, which initiates the common pathway. And finally, direct thrombin inhibitors are inhibitors that directly bind to thrombin. Thrombin, again, forms the fiber mesh and also plays a pivotal role in the positive feedback loop that recruits for more platelets as well as thrombin. Finally, we will go over the acronym that encompasses the direct thrombin and factor activated 10A drugs. The acronym is Aristotle engages rocket to relay message about bad fear of stroke and embolism. So the first component of the acronyms are actually clinical trial that supports the use of direct oral anticoagulation over vitamin K antagonist, which is otherwise known as warfarin, in reducing the rates of mortality, stroke, or systemic embolic events in hemorrhagic stroke in atrial fibrillation patients. These clinical trials consist of Relay, Rocket, AF, Aristotle, and the Engage trial. BAD is the acronym that spells out the direct thrombin inhibitors. So B for bivalirudin, A for agatroban, and D for dabigatran. FEAR is the acronym component for all the activated factor 10A inhibitors. F for fondaparinux, E for edoxaban, A for apixaban, R for rivaroxaban. Fondaparinux is also the drug of choice for patients who are allergic to heparin. So think about F for FAR, as it is the furthest from being associated with heparin. Thank you for watching. If you found these videos to be helpful and enjoyable, please consider subscribing and hit that notification bell to stay tuned for future videos. Please comment below and let me know what other content you would like to see next. And as always, let's continue to empower a different way to envisioning success. And I'll see you on the next one.